Do you know what the best cancer treatment is? Well, if you said prevention, you're correct. I want to talk a little bit today about reducing your risk of developing breast cancer. This is both for men and women. And actually, these tips will help you to reduce your chances of getting cancer overall. We now know from several years of research that the driver for all chronic illness and disease is inflammation. And there's a lot of things that we can do to improve our chances of stopping that inflammation. We're going to talk again, like we've talked many times before, about lifestyle. So nutrition is very important in keeping inflammation down. As a matter of fact, one of the most inflammatory substances that we put into our body is foods. That comes in the form of sugars, highly processed foods, grains, and we don't eat enough antioxidants. So those brightly colored fruits and vegetables that actually help decrease oxidation, or if you will, rust inside of our body. Oxidation contributes greatly to cancer. The other thing that we always have to do is move our bodies. That really helps a multitude of things, but in particular for cancer prevention, it helps to move the lymph. So the lymph nodes that we have in our body are there to help us prevent infections and diseases like cancer. So when that lymph fluid becomes stagnant because we're sedentary, we don't move, that puts us at higher risk for developing a cancer. We have to sleep. Our body repairs itself and detoxifies at night while we sleep. And of course, we also have to reduce or manage our stress better, because high cortisol or low cortisol decreases our immune response. The other thing that we have to think about, again, whether you're a man or a woman, is how you metabolize your estrogen. So metabolization of estrogen happens through the liver. It's a detox process. And if you're not metabolizing your estrogens well, those estrogens over time will build up. And if they go down the wrong detoxification pathway, they can become more dangerous for your body, putting you at higher risk for not only breast cancer, but also uterine cancers. We always want to balance estrogen with progesterone. And as we age, our progesterone levels tend to drop, and then our estrogen levels can drop. So we have to look at balancing them out. And then the other very important thing for our immune system, because 70 to 80% of our immune response resides in our GI tract, our gastrointestinal tract, our gut. And so if that is not healthy, if the bacteria in our gut, the good guys, are imbalanced with some of the bad guys, then we can't adequately protect our bodies from any kind of infection that comes our way, but also any kind of cancer that our immune system needs to be strong and fight for. The other thing about the immune system, there is an enzyme called beta-glucuronidase. And if that beta-glucuronidase is too high, what that does, it breaks down the estrogen and it doesn't rid the body of it. So then that estrogen that gets broken down through our liver goes to our colon so that we can eliminate it. But if we have that enzyme, it doesn't let our bodies to eliminate it. And so that estrogen just gets reabsorbed again, putting us at an imbalance for a little bit higher estrogen than we need to have. At Julian Healthcare, I do testing on hormones to determine those estrogen pathways, to determine the levels of the different hormones. And we also do stool testing to look at the gut health and to look for that enzyme that I'm talking to you about. If you're interested in hearing more or having a personalized treatment plan put together to help you decrease your risk for any cancer, I would love to help you.